Today, we will examine the federal government's efforts to conduct oversight on vital pandemic relief spending. Over the past 2 years, Congress has authorized historic levels of emergency relief to address the public health and economic challenges caused by the COVID-19 pandemic. This important emergency relief helped ensure that families could make ends meet and businesses could continue to pay their employees during the lockdowns. It also helped ensure that much-needed personal protective equipment could be secured and that life-saving vaccines could be developed to help get our nation closer to bringing the pandemic under control. The federal government's efforts to tackle this pandemic have been a monumental task, and our federal agencies have been working literally around the clock to help keep Americans safe and make sure that this critical aid reached families, small businesses, healthcare providers who needed it the most. There's no question that there were challenges in getting these programs off the ground, and that criminals wishing to take advantage of these resources made fraudulent attempts to access these funds. That's why I was proud to work with Senator Johnson to ensure that these important emergency relief bills included important oversight mechanisms like the Pandemic Response Accountability Committee, or PRAC, to ensure that these funds were being used as Congress intended and to prevent waste, fraud, and abuse. Along with the PRAC, each of the agencies represented here today have taken exhaustive efforts to ensure the effective use of nearly $7 trillion in COVID-19 relief funding that was passed by Congress that provided critical aid to Michiganders as well as Americans all across our country. Over the last 2 years, these key oversight bodies and agency inspector generals have issued more than 350 reports and more than 500 recommendations to improve our nation's pandemic response. This included efforts to uncover inefficiencies, such as outdated systems and infrastructure, and develop innovative practices to detect and prevent fraud and identity theft while improving transparency for all American people. The PRAC's Pandemic Analytics Center of Excellence has facilitated access to more than 150 million records that would otherwise have not been available to inspectors general and law enforcement. And the broader inspectors general community has made nearly 1,300 indictments and 1,000 arrests for pandemic-related fraud. While I'm grateful, very grateful for these successes, and our federal government got relief funds out the door as quickly as possible, the swift release of funding also exposed the potential for mismanagement and the lack of internal controls that left many programs vulnerable, especially to fraud. For example, instead of a thorough examination of an applicant's eligibility, many programs substituted this requirement with quicker self-reported information, which contributed to funds mistakenly being sent to deceased individuals, ineligible applicants, or fraudulent criminal schemes. In fact, the unemployment insurance program has consistently ranked as one of the highest risk federal benefits programs for known or suspected fraud, and the Department of Labor Office of Inspector General estimates that more than $87 billion they have been paid out inappropriately. Most shockingly, even before the release of the COVID-19 relief funding, some estimates note that unemployment insurance often has improper payment rate above 10%, including for the 14 of the last 17 years. While some measures have been taken to remediate these very well-known problems, tracking down and recouping money has already been improperly spent, has proven to be a difficult and inefficient and ineffective solution. Congress and the administration must better understand the underlying causes that led to the fraud across these programs and put the government on stronger financial footing for any future spending priorities. I've been look forward to this hearing today and to hear from our panel of experts who are going to discuss their roles in preventing improper payments and reducing fraud across the federal spending program. Ranking Member Portman, you are recognized for your opening comments.
Thank you, Chairman Peters, and thanks to our witnesses. Look forward to hearing from you. As Chairman Peters has said, we spent an awful lot of money on COVID. In fact, over the past 2 years, we have spent more than $5 trillion of taxpayer money to address the COVID-19 crisis. It's gone for some necessary things, expanding unemployment benefits, supporting small businesses at a time they needed it, and other challenges. 5 times we did this on a bipartisan basis. And I was proud to be part of that effort. In fact, the biggest of those bills, I was one of the 5 Republicans, along with 5 Democrats, who helped put it together. Unfortunately, as the new administration came in, they decided to go it alone and not to take a bipartisan approach. And at the time, I was very concerned about that, in part because it was not going to be something that we could do together as we had previously, but also because much of the money, in fact, most of the money that was spent had nothing to do with COVID. And at the time, some, like Larry Summers, former Treasury Secretary, said this could set off inflation pressures of a kind we have not seen in a generation, end quote. Many of us echoed those concerns with the $1.9 trillion spending package, again, that was done on a partisan basis. And unfortunately, it looks like those warnings have largely come true. Inflation's at 7.9%, a 40-year high. So that's one issue. We are where we are. But against this backdrop, we have also learned that billions of dollars spent to help American families were stolen. Stolen by individual criminals, stolen by transnational criminal organizations, many of whom used fraudulent schemes to exploit the pandemic for their own financial gain. Many of these criminals, by the way, were, as I said, transnational, meaning overseas, from places like China and Nigeria, and Russia, and elsewhere. It's hard to know exactly how much money was stolen. Perhaps we'll learn more about that today, as I know many of you have analyzed this situation. The estimates range from $87 billion to $400 billion. To put this in context, the low estimate there, $87 billion, of course, is larger than the entire annual budget for the Department of Homeland Security, over which we have oversight. We could send almost 6 times the recently authorized amount of aid to Ukraine with this money that was stolen from the American people. So we were talking about probably the biggest fraud ever committed against the American people. And even though we don't know exactly how COVID relief funds were spent or exactly how much was stolen, we have, of course, a request to spend a lot more on COVID now. And I'm not suggesting we don't have additional needs, but it sure would be nice to know how we spent the money that the taxpayers sent us to protect, and why so much of it didn't get to the right place before we have billions more going out the door. One of the biggest sources of fraud involved the unemployment insurance programs. As you know, these benefits were designed to help Americans who lost their jobs during the pandemic. I thought it was necessary to help those individuals, but billions of these dollars went to criminals who used stolen identities and lacked safeguards to steal the money away from Americans who needed it. Unfortunately, we did not have the infrastructure set up to be able to protect those funds. Another major source of fraud involves the Paycheck Protection Program and the Economic Injury Disaster Loan Program. These are 2 programs that worked well for many small businesses to be able to survive the pandemic. Like the unemployment insurance funds, however, these small business loans became easy targets for criminals, both here and abroad. Money that was supposed to be used to employ American workers instead funded organized crime, purchased luxury cars and mansions for criminals. We now know more about this from some of the fraud schemes that have been revealed, and again, we'll probably hear more about this today. The purpose of this hearing, as I see it, is to examine the government's oversight of this massive spending. Specifically, we need to understand how the fraud occurred, what we can do to get the money back. Some of it has been recovered, and I want to hear more about that. And of course, most importantly, how we can prevent this from happening in the future. If we're going to spend billions more, let's figure out how to try to avoid this fraud being perpetrated on American taxpayers. At the beginning of the pandemic, Congress established the Pandemic Response Accountability Committee to provide oversight of the pandemic relief. This group of 21 inspectors general were appropriated $120 million and tasked with preventing fraud and mitigating risks associated with the pandemic relief funds. And the Government Accountability Office, the Office of Management and Budget, and the Department of Labor's Inspector General also had a role to play in overseeing these funds and these programs. Each of the witnesses today brings a unique perspective from these agencies, and I appreciate their work and appreciate them being here. I look forward to hearing what they have to say about their role in the oversight of these funds, about their plans to help fix the structural problems that allowed the fraud to occur in the first place. And again, I thank them for their service and for testifying today and look forward to the discussion. Thank you, Mr. Chairman.
Thank you, Ranking Member Portman. It's the practice of the Homeland Security and Government Affairs Committee to swear in witnesses, so if each of you would please stand and raise your right hand. Do you swear that the testimony that you will give before this committee will be the truth, the whole truth, and nothing but the truth, so help you God? Thank you. You may be seated. Our first witness is Jason Miller. Mr. Miller serves as the Deputy Director for Management at OMB. In his role, he coordinates government-wide management initiatives to empower the federal workforce for a more equitable and effective federal government. Mr. Miller is also chair of the President's Management Council, where he leads the development and implementation of the President's management agenda. Previously, Mr. Miller served as the Deputy Assistant to the President and Deputy Director of the National Economic Council in the Obama administration. Mr. Miller, welcome to the committee. You may proceed with your opening comments.
Thank you, Chairman Peters, Ranking Member Portman, and members of the committee. I appreciate the opportunity to speak to you alongside my colleagues from the oversight community. My testimony will focus on OMB's role overseeing relief spending in cooperation with the oversight community, actions taken, and importantly, considerations for the future. Implementation of the American Rescue Plan and other pandemic relief efforts helped jumpstart our economic recovery. Moody's estimated that without ARP, real GDP in 2021 would have grown by 3%. Instead, it grew by 5.7%, the fastest since 1984. Last month, the economy added 678,000 jobs, bringing total job growth since January 2021 to 7.4 million and the unemployment rate to 3.8%. It is also true that the unparalleled scope and speed of pandemic relief have highlighted real challenges, including in program design and integrity, benefit systems, and equitable delivery. The speedy processing of benefits at the outset of the pandemic came with costs, affecting program design and internal controls. The pandemic revealed cracks in under-resourced benefits delivery systems. The 53 different unemployment insurance systems run by states and territories were overwhelmed by the historic surge of claims that jammed their underfunded and outdated IT architecture, resulting in backlogs and a rise in improper payments, including fraud. And as the pandemic disproportionately harmed underserved communities, early relief efforts often failed to reach those most in need. To tackle these challenges, the administration is focused on delivering timely relief to the intended beneficiaries while strengthening government's ability to act as a trustworthy steward of taxpayer funds. The administration's collaboration with the oversight community has proven essential. In December, OMB institutionalized the administration's commitment to the role of inspectors general through government-wide guidance, instructing agencies to restore and respect IG's integrity and independence, to ensure IGs can exercise their vital role. Through ARP implementation, we have focused on getting it right at the front end, working towards prevention to mitigate risk. New joint gold standard meetings offer a good example. OMB and the White House ARP implementation team convene agency officials, IGs, and leadership of the PRAC to jointly review new or expanded ARP programs before launch. The administration has taken concrete steps to strengthen relief implementation. SBA quickly recalibrated the PPP program in early 2021 to better assist the smallest of small businesses and companies. OMB released government-wide guidance for ARP based on lessons learned from 2020, requiring robust controls and rigorous new reporting requirements. The Department of Labor used ARP funds to tackle immediate challenges, including grants to 50 states and territories to fight fraud and improve accessibility, Tiger teams to work hand-in-hand with state UI officials to fix problems. DOL changed policy to require states to give Mr. Turner and his team access to state UI claim and wage data to help detect and prevent fraud. And the Department of Justice and others in the enforcement community are undertaking an unprecedented effort to prosecute and recover stolen funds. DOJ reported last week they have filed criminal charges against over 1,000 defendants. opened over 240 civil investigations into more than 1,800 individuals and entities, together involving billions of dollars in suspected fraud. I want to call out 4 areas for further consideration. First, cross-cutting vulnerabilities require cross-cutting solutions. The rise of identity theft targeting federal benefits is ongoing. The President launched the Initiative on Identity Theft Prevention and Public Benefits last year, and we were working towards additional steps through a forthcoming executive order to better prevent and detect identity theft based upon lessons learned. Second, victims of identity theft deserve increased attention. They face a complex recovery process to resolve resulting harms. Third, Congress should consider heightening penalties for criminals who commit egregious pandemic-related fraud by amending the Emergency and Disaster Assistance Fraud Penalty Enhancement Act of 2007. Fourth, cross-cutting efforts and capabilities enabled by the PRAC warrant consideration for ongoing capabilities and as a model for future oversight of major investment initiatives. Thank you for your attention to these issues. I look forward to working with the committee and the oversight community to further strengthen implementation of federal programs.
Thank you, Mr. Miller. Our next witness is Gene Dodaro. Mr. Dodaro is the 8th Comptroller General of the United States and head of the U.S. Government Accountability Office. As Comptroller General, Mr. Dodaro helps oversee the development and issuance of hundreds of reports and testimonies each year to various committees and to individual members of Congress. He has also personally testified before Congress several times on the long-term outlook for federal spending, as well as other important national issues. Mr. Dodaro, it's great to see you back again before this committee. You may proceed with your opening comments.
Thank you very much, Mr. Chairman, Ranking Member Portman, members of the committee. I'm very pleased to be here to talk about our work on COVID-19 relief spending. As has been mentioned, great urgency was given to providing quick relief to deal with public health issues and economic repercussions of the pandemic. However, trade-offs were made that limited progress in ensuring transparency and accountability over this money. Controls that should have been in place before payments were made were either reduced or eliminated. Also, monitoring efforts, post-payment reviews, and other efforts weren't instituted as fast as possible after the payments were made to try to assess the integrity of the programs and have recovery efforts underway. Now, these shortcomings were exacerbated by already existing problems in financial management in the federal government. Chief among these is a serious improper payment problem. The government's got a payment problem, and lack of focus on prevention of audits, not after the fact pay and chase. With regard to improper payments, since 2003, reported estimates total over $2.2 trillion. Just in fiscal 21 alone was $281 billion, a jump from $75 billion in the prior year. This involves 16 agencies, 86 federal programs, 26 or 30% of them have over a 10% improper payment rate. Also, and this isn't a complete estimate. Some are not reporting, some of the estimates aren't rigorous. With regard to the fraud prevention issue, we worked with the Congress in 2016 to help Congress pass a Fraud Prevention Act that was supposed to have agencies focus more on preventing fraud. This was slow to be implemented. Therefore, we weren't in a good position when the emergency pandemic came around to prevent the fraud that occurred. So we are recommending today 10 different legislative solutions that Congress could pursue to address both what we found during the pandemic and these underlying persistent, serious, fundamental financial management issues that the government has. Number one, chief financial officers ought to be given more responsibility for improper payments estimates, to certify their accuracy, to monitor corrective actions. Right now, it's just the program people who administer the programs that are providing the estimates. So we need more rigor in the estimates, more transparency in corrective action plans. They ought to be mandated to be reported in agency financial statements every year. and any new program, in my opinion, over $100 million ought to be automatically determined to be susceptible to improper payments. There should have to be proof it's low risk, not prove that there's a problem. And this would ensure improper payment estimates are made in the first year of the program. Right now, it's 2 or 3 years down the road before these estimates are made, and problems are already entrenched into the program activities. Secondly, with regard to fraud, we need to reinstitute the reporting requirements that the agencies have to report on the status of their fraud prevention efforts. This would provide better visibility and more assertive congressional oversight over their efforts, because only if the agency officials can prevent fraud is the most meaningful way that this could be addressed. And also, I believe that the what's now called the PACE Committee ought to be permanently instituted and focused on all federal spending, not just COVID spending. I recommended this back in 2015 after the Recovery Act. Unfortunately, Congress and the administration didn't follow that, and so this effort was put in place, was too late. It was a year after the efforts. It was only limited to the pandemic, so that could be fixed. Also, internal control plans ought to be put in place immediately for emergencies, so they're already in place. We know what the problems are. They could be tailored later if there's a unique need for the emergency, but they ought to be put in place. Normal controls is not sufficient, as we've seen here. And OMB should do this. Congress should mandate that it be done. Also, we need to reinstitute the requirement for the Inspector Generals to audit periodically all federal spending that's displayed through usaspending.gov. So I have other suggestions, but my time's up. I'm happy to answer questions at the appropriate time. I appreciate the invitation to participate today. Thank you.
Well, thank you, Mr. Dodaro. Our next witness is Mr. Michael Horowitz. Mr. Horowitz serves as the Inspector General of the Department of Justice and as the acting chair of the Pandemic Response Accountability Committee. In his IG role, Mr. Horowitz is responsible for combating waste, fraud, and abuse in DOJ programs, and he simultaneously leads the PRAC, a committee of 22 federal inspector general that oversee federal pandemic-related emergency spending. Prior to his time at DOJ, Mr. Horowitz worked as a partner at a private law firm. His practice specialized in white-collar defense, internal investigations, and regulatory compliance. Mr. Horowitz, welcome back to the committee. You may proceed with your opening comments.
Thank you, Mr. Chairman, Ranking Member Portman, members of the committee. Appreciate the invitation to speak to you today. This committee played an instrumental role in creating the Pandemic Response Accountability Committee, or PRAC, in March 2020, to oversee what's now over $5 trillion in pandemic relief spending across 426 federal programs at 40 agencies. Given the magnitude of these responsibilities and the amounts involved, we've sought to develop, and I believe have developed, a new model for conducting oversight in a crisis at the Inspector General community. And that's involved promoting transparency by providing the public with accessible and comprehensive data about spending, and that's on our website, pandemicoversight.gov. We've collaborated across the oversight community to identify cross-cutting issues and risks. We've been detecting and preventing fraud, waste, abuse, and mismanagement by using a leading-edge data insights that we've been able to obtain through our data analytic tools, the PACE, as the chairman referenced, and we've been able to hold wrongdoers accountable by marshaling the investigative and analytical resources of the oversight community. One of our foundational responsibilities is transparency by providing information to the public about pandemic-related spending. Information is power, and that is what we are trying to do for the American public, is to see how their money has been spent. Information also brings accountability. You can't have accountability without transparency. Unfortunately, we've faced challenges in putting forward all of the information that we think should be out there. We've detailed that in two different reports, one in 2020, one in 2021. where we've identified significant agency weaknesses in providing complete data and gaps in reporting information from recipients. Our reports include recommendations on how to address that. We've had significant discussions with leadership at OMB and the administration about how to address that. We appreciated OMB's release of a memorandum addressing some of these issues by outlining the need for detailed and accurate award descriptions, a problem we've seen, enhanced transparency of spending through the use of disaster and emergency funding codes, something that's been missing, and a commitment to work with PRACs and IGs to strengthen payment integrity, as the Comptroller General just indicated. We've also reported other lessons learned through our work. First, agencies can't rely solely on self-certifications of individuals that they're eligible for benefits. Second, underserved communities should be prioritized for funding where that's needed, as we saw in many instances here. Additionally, agencies should use existing data to verify eligibility, like the Do Not Pay system. Further, relief guidance needs to be gotten out quickly for new programs. And finally, programs need to fully disclose where their money went and how it was spent. Briefly, let me turn to collaboration. It's something we recognized we need to do at the outset. We've done that in the past and continue to do it with GAO and their leadership. We've also moved forward in a very significant way in working with our state and local counterparts, something that, frankly, we hadn't done much of in the federal IG community and something that's been very central to the work that we've done. We've also been able to develop a very strong working relationship with OMB leadership and the ARP implementation team. I've outlined that in my written statement, and we very much appreciate that working relationship and think, frankly, it's the model for how effective oversight should occur going forward in the future. Finally, let me touch on the accountability efforts that we've undertaken, and that we've done through the use of data. You can't oversee $5 trillion in spending with just people. You need the data. That's where our Pandemic Analytics Center of Excellence comes in. It's critical to our efforts. It's something that has led to our providing nearly 200 requests and addressing requests from law enforcement in looking at oversight issues and fraud issues. As has been mentioned, the oversight community, the Federal Inspector General community, our work has resulted in over 1,200 indictments and complaints, nearly 1,000 arrests, almost 500 convictions. It's critical for the community to have these capabilities. I appreciate the Comptroller General's support for those efforts. As he noted, he supported it back in 2015. It went away. We had to spend a year and more taxpayer money recreating that database because it went away in 2015. And we look forward to working with OMB and hopefully their support for that effort. We're going to use all of our tools, criminal, civil, administrative, suspension and debarment, forfeiture, to try and recover the funds that have been stolen that have been referenced. And we're doing that, and we're making every effort. Look forward to continuing to work with the committee on these efforts and appreciate your support for our work.
Well, thank you, Mr. Horwitz. Our final witness is Larry Turner. Mr. Turner is the Inspector General for the U.S. Department of Labor, or DOL, where he helps detect and deter waste, fraud, and abuse in DOL programs. Mr. Turner oversees critical programs on unemployment insurance, worker safety, pension and health care benefits, and other essential needs. Mr. Turner also leads investigations into organized crime influence and labor racketeering, corruption in employee benefit plans, internal union affairs, and labor management relations. Mr. Turner, welcome to the committee. You may proceed with your opening remarks.
Thank you, Chairman Peters, Ranking Member Portman, and distinguished members of the committee. Thank you for the opportunity to testify today. Although the OIG is responsible for overseeing all DOL programs, my testimony today will focus on our oversight of unemployment insurance during the pandemic. The views expressed in my testimony are based on the independent work of the OIG and are not intended to reflect DOL's positions. Mr. Chairman, the OIG has remained committed to assisting DOL and Congress in improving the efficiency and integrity of the UI program. In our view, strengthening the program to prevent and detect fraud are key objectives to ensure that unemployed workers quickly receive needed benefits while safeguarding taxpayer dollars. For many years, the OIG has highlighted significant concerns with DOL's and states' ability to deploy UI benefits expeditiously and efficiently while ensuring integrity and adequate oversight. The pandemic exacerbated these challenges, creating the perfect storm. As the OIG reported, states were not prepared to process the historic volume of claims, resulting in significant delays in benefits. The PUA program initially relied on claimant self-certification without evidence of eligibility, and the unprecedented infusion of federal funds gave fraudsters a high-value target to exploit. That, combined with easily attainable stolen identities and system weaknesses previously identified by the OIG, allowed criminals to defraud the program. Consistent with the OIG recommendation, DOL reported an improper payment rate of 18.7% for 2021. Applying the rate to the $872 billion in estimated pandemic UI payments, at least $163 billion in benefits could have been paid improperly, with a significant portion attributed to fraud. Indeed, following the passage of the CARES Act, fraud against the UI program exploded. The OIG has received more than 143,000 complaints and has independently opened more than 38 investigative matters concerning UI fraud. That represents 1,000 times increase in the volume of UI investigative matters. The OIG took immediate action to respond to this crisis. We hired additional investigators, deployed federal and contract staff to audit the program, established a pandemic rapid response team, and strengthened our data analytics program. We also worked with DOJ to create a national UI task force, leveraged SIGI and PRAC resources, and implemented outreach and education programs with the states. In addition, we collaborated with the PRAC, DOJ, and the Secret Service to recover fraudulent funds. And we engaged with international law enforcement partners to pursue transnational organized criminal groups targeting the UI program. To date, our efforts has resulted in the execution of more than 850 search warrants, 749 indictments, and $830 million in monetary results. From our oversight perspective, we've issued an advisory report at the start of the pandemic, identifying 6 initial areas of concern for DOL and the states to consider when implementing the CARES Act. Since then, we have released 9 reports and alerts. For example, we identified more than 3 million claims totaling nearly $17 billion in potential fraud, including payments to deceased individuals and federal inmates. In response to our recommendations, DOL has instituted efforts to improve the UI program. However, several OIG recommendations remain unimplemented in the following areas. OIG's need to access UI data, states' need for adequate staffing and modernized IT systems, timely and effective guidance to states, and controls for improper payments. Mr. Chairman, I would like to also highlight 2 challenges the OIG faced, the first being the lack of direct access to UI data. For many years, the OIG has requested access to data to proactively monitor the program for systemic weaknesses and potential fraud. Given the magnitude of the issues we saw in the beginning of the pandemic, we took the unprecedented step of using IG subpoenas to obtain UI data directly from the states. The data allowed the OIG to identify billions in potential UI fraud. However, the IG subpoenas process took months and delayed our ability to detect fraud early in the pandemic. The second challenge we faced was resource limitations. The OIG received $38.5 million in much-needed supplemental funding to oversee DOL's pandemic responses. However, in light of the unexpected FY22 appropriation, which held the OIG in its FY21 levels, additional funding would allow the OIG to address the issues I've discussed today. Mr. Chairman, thank you for the opportunity to testify about our work overseeing the UI program. I also want to thank the dedicated OIG employees who continue to work tirelessly in support of our oversight mission. I look forward to answering any questions you or the members of the committee may have. Thank you.
Thank you, Mr. Turner. Mr. Horowitz, the Pandemic Response Accountability Committee, or PRAC as we're referring to it, without question, had a Herculean effort over these last 2 years, as you mentioned in your testimony. But I'd like you to tell the committee, in your opinion, has the PRAC been successful in its mission to date? And then, if you could let the committee know what more can the PRAC and the rest of the oversight community do to stop fraud and identity theft and the bad actors that are out there, and be specific about that as well.
Certainly, and I do think we've been very effective in addressing this Herculean task. As you know, when we were created back in March 2020, we were only overseeing about $2 trillion of federal funds. It grew to over $5 trillion. The key to our ability to do that has been our ability, thanks to this committee's support, the data analytics platform that we've built, the PACE. As I mentioned, nobody can oversee that kind of funding without the ability to get good data. It's what IG Turner just mentioned. You need access to information, and you have to have the systems to be able to run against it. Through doing that, we've identified, for example, multi-dipping across programs, because we've seen individuals applying with the same fraudulent information across programs. We've seen the use of the payment to individuals on do not pay lists and other lists. It's really enabled us to identify, find the fraud, as well as find weaknesses in department programs. So it's been critical. I think there's one bill I'd mention that I think would make a difference. It's the Administrative False Claims Act of 2021, which you are co-sponsoring along with Ranking Member Portman. Senators Hassan and Lankford of this committee are also co-sponsoring it. It would allow us to pursue administratively claims of up to $1 million, not have to go through the district court process. We think that's likely to be a substantial effort, and so we're hoping the Senate will pass that. The bill's on the floor. We've also considered and are thinking about questions related to statutes of limitations. As you know, in prior crises, Congress extended the statute of limitations with regard to bank frauds from 5 years to 10 years. Well, it turns out that the fraud here, even though lenders were giving out the money, the fraud here is often, for example, with the Payment Protection Program, really of the SBA, not the banks. So there's a real question of whether that extended statute of limitations applies. And so loans that were given out in March 2020 would have a statute of limitations potentially, depending on the facts, from March 2025, and given the amount of fraud, that may be an area that's worth considering as well.
Yeah, very good, very good. Mr. Turner, as you well know, probably one of the most high-profile areas for the improper payments and pandemic fraud were in the 54 state and territorial unemployment insurance programs. And as you stated in your testimony today, as well as some of the reports your office has published, there were serious challenges for the DOL, OIG to get data from the state workforce agencies to conduct the audits and investigation that you needed to do. I've heard similar concerns about timely and complete access to important data from other IGs as well. Could you please discuss for the committee the impact on IGs when you are unable to get timely and complete access to this critical data?
Yes, Chairman, I'd be more than happy to do so. One of the challenges and one of the issues when we can't get direct access to the information is that it slows the process. So even once you've identified problem areas, it just slows the process down when you actually have to go other ways to get the information. And for us, one of the tools that we have to use was our IG subpoenas. Because we did not have direct access to labor data coming from the states, and there's 54, as you mentioned, states and territories we had to look at. By us not being able to get that information directly, it meant months that the pay problems, fraud problems were able to exist. We tried to go through the DOL to expedite this problem, but DOL had a challenge with the CARES, the extra doctrine with the CARES in terms of some of the information. And part of that problem was that it did not allow them to provide us investigative audit information. We were able to get investigative information, but not audit. So we pushed back because we wanted to get from the department all the information right away. and the department would not allow us to do that. So we went subpoenas, and we went to IG subpoenas. We did 2 rounds of IG subpoenas because that allowed us to get the information that we needed in a more direct fashion. And able to do that, we were able to identify $17 billion of problem areas that came from stolen identification with Social Security numbers. And part of that was through multi-states, multi-claims, through deceased people, as well as through several other areas to include cemeteries with some of the areas that were identified. So those are some of the challenges that we faced.
Great. Well, thank you. Mr. Horowitz, although I know you can only speak on behalf of the PRAC in your role as the IG at DOJ, could you provide this committee any perspective on how successful the DOJ and the FBI have been in obtaining arrests and convictions for pandemic-related fraud? And then on top of that, do you believe that the new chief prosecutor that was announced by the White House earlier this month can improve the government's efforts to address fraud, like we're hearing from UI and the Paycheck Protection Program?
Yes, certainly, Mr. Chairman. The importance of coordination here can't be overstated. And so we are, for example, part of the department's fraud task force. We've separately created at the PRAC our own fraud task force to bring together the IG community with our partners in law enforcement. We've worked very closely with the FBI to ensure that kind of coordination and to provide them with access to certain information that we have through the PACE, but they may actually not have access to. So it's been a very important, collaborative, strong working relationship. I think it's very important, having been in AUSA myself in my prior stint at the Justice Department, having that kind of coordination at the headquarters level is critical. These are issues that aren't limited to one district in the country or one state in the country. They're cross-cutting, they're international in many instances, so it's very important to have that relationship, that connectivity. We have a very strong working relationship. I've already gotten a reach out a couple of times by the new head of, by the new prosecutor that was named the other day, was at a meeting with the AG and the deputy AG to talk about these issues last week. So they are including us, me not just as the IG at Justice, but as the chair of the PRAC.
Great. Well, thank you. Ranking Member Portman, recognized for your questions.
Thank you, Mr. Chairman. And again, thanks for the work you all are doing in a very difficult situation. I want to start with Inspector General Turner and focus on the unemployment insurance fraud that you talked about. You said that we know that at least $163 billion in pandemic UI benefits were paid improperly, and a significant portion of that is attributable to fraud. You said that fraud cases have exploded by about 1,000%. Could you describe your efforts to date to try to recover some of those improper payments? Approximately how much have we been able to recover so far, and what's our plan to try to recover more of that $163 billion plus in the future?
Just let me say that I can start off by answering your second question first. We have $830 million in terms of the monetary gains that we've found so far that we've been able to recover. It is a challenge because I think we believe that it has to be a proactive effort initially to stop and prevent fraud before it actually happens. The concern in terms of how we get it back, we again have, we go back to when we started the program. When we first started 20 years ago, we've identified several problems within the program. A lot of it is lack of staffing and lack of modernization. So that has allowed some of the fraud to occur. And although we talk about 18.71% as being the fraud rate, therefore on the $872 billion, that is what we believe, and that's just the IG figure of that $163 billion you're talking about. And we believe that it's going to be somewhat difficult to get that back. Number one is because only a lot of the funds have been expended before we actually are able to get it back, because so many of the fraudsters have already spent it in high dollar value items, whether it be homes, whether it be vehicles or whatever. So some of that is hard to get back. A lot of it is also tied up in the courts in terms of restitution. Some of the ones that we have identified, it's going to take years to actually see what that total amount of recovery will be.
Well, thank you for doing everything you can to get that taxpayer money back. $830 million is a lot of money. On the other hand, it pales in comparison to the $163 billion, doesn't it? So,
Yes, it does, and
whatever we
we
can do to get that
take
money
every
back.
loss, every dime of government money. We take that serious and trying to recoup all that we can.
Yeah. Let us know how we can be more helpful. And, part of the problem you said is that it's converted into assets. Those assets can be seized as well. And it seems to me that, particularly with regard to some of the foreign nationals, that we should have a government-wide approach to this, getting more help from, in that case, the Department of Justice. So, Chairman Horowitz, PRAC has identified a lot of gaps in existing data sources. You talked about this a little bit. So the lack of transparency means less accountability. What are the key gaps in the existing data sources that you see? And in your October 2020 report, you identified 13 corrective actions, all executive branch, it looks to me, to mitigate these gaps. Tell us how many of those 13 recommendations have been implemented.
So on this issue, Senator Portman, the gaps are many. As you indicated, we've outlined them in our 2 reports. Let me highlight 2 of them. There's a significant issue with coding and putting sufficient information in about naming what the money went for. Our second report lays out thousands of grants that have either program names associated with it or things like codes of initials. Nobody looking at that, not us as oversight professionals, the public looking to see where money went, would have any idea where that money went from looking at that reporting data. That's not what I think Congress intended when they set up the Data Act and other mechanisms for reporting through usaspending.gov to report out for the public to learn how their money was being spent. So that's one significant issue. Even when there are reports of where the money is spent, we're finding thousands of instances where I've referred to it as gibberish is there. You can't make heads or tails of what the money's for. Another major problem we've found is going beyond the first level of spending to figure out where the money actually went to and how it was actually being used. You can see oftentimes how agencies distributed the money in the first instance, but in many of these programs, as you know, particularly grant programs, the money goes even further downstream. And there's no information about that flow. Finally, the information reporting back from recipients. What did they do with the money? How did they spend it? One of the big questions we hear all the time is, so the PPP program, $800 billion in the Payment Protection Program, how did that impact employment? We don't know. The agency doesn't know because the information isn't being collected.
Well, huge gaps, and understanding we need to get money out the door quickly. There's no reason not to have that kind of coding and to understand, where the money's going, and then to follow the money to see whether it's working. In terms of the amount stolen, $87 billion to $400 billion. That's a pretty big range. We just learned from the IG at Department of Labor, it's $163 billion there alone, at least. So it's more than $87 billion. Can you give us your best guess as the PRAC chair and as someone who's been looking at this for a long time and has some perspective on it? How much was stolen?
Senator, I wish I could answer that right now. A couple reasons that's a challenge. First of all, we don't have all the data just yet. Secondly, we have lots of cases ongoing, and of course there's a difference between an improper payment, of which there's billions and hundreds of billions of dollars, and a fraud, and we've got to sort that out through the investigative process. So I can't give precision at all. I'm not even trying to give a wild guess yet at what the fraud number will be. It will be very large. The improper payment number, as the Comptroller General indicated, is disturbingly large. We know about, just for example, $3 billion went out the door right away to deceased payees through the IRS and the initial loan check distributions. 50,000 plus PPP loans went to individual entities on the do not pay list.
Well, Chairman Horowitz, give me your best educated guess. Is it less than $400 billion or more than $400 billion? That's the top of the range.
Senator, I'm going to be careful in giving a guess. It's certainly in the 3-digit billion number. How big it is, I'm just not prepared to get.
So you're prepared to say it's over $100 billion, but not prepared to say whether it's $400 billion or $300 billion?
Well, I think in light of, obviously, just the UI numbers that IG Turner just mentioned, if you're talking about $87 billion plus of potential fraud in that program.
163,
I'm sorry, billion plus in that program, you are obviously already north of that number. And I know from SBA, IG, the Payment Protection Program, the EIDL program, is the other place where we're finding very substantial fraud.
Yeah. Well, to help you, we want to get the Administrative False Claims Act done, and we're hoping to get that done in the Senate soon. And again, with regard to these 13 corrective actions that you proposed, I'd like to know if you get back to us how many of those have been implemented, how many have not, and these are all administrative, executive branch functions, so we can help perhaps to put some focus on that. Thank you, Mr. Chairman.
Absolutely.
Thank you, Ranking Member Portman. Senator Johnson, you're recognized for your questions.
Thank you, Mr. Chairman. I think we're probably only looking at the tip of the iceberg here. I think you're kind of indicating that as well. I think part of the big problem is the fact that Congress took a shotgun approach to COVID relief as opposed to targeting our relief. And so I personally think it was hundreds of billions of dollars that went to people that, in the end didn't need it. And a lot of them didn't commit fraud. We just set such a low hurdle rate, for example, in the PPP program. Again, if you were concerned about the economic uncertainty, you qualified, and then we just forgave the loan. I thought it was madness. I spoke out about it at the time. But a lot of this falls on Congress's shoulders here in terms of the amount of fraud that eventually will be uncovered, and we'll probably won't uncover the vast majority of it. I don't see how anybody can take a look at our response to COVID and call it a success. 965,000 Americans dead. The human toll of the economic devastation from the widespread shutdowns, I argued against those at the time. What we've done to our children. I want that to sink in, what we've done to our children. The delayed learning, I'll tell you, whether you agree with masks or not, I'll tell you where masks wouldn't work on a child. And yet we've subjected them to two years of wearing masks, delayed speech, couldn't see their teacher's face, the smiles of their classmates. We need to really do oversight on what our response was, what a miserable failure it was, so it never happens again. Mr. Horowitz, you've done a lot of investigations. I've sent 35 oversight letters. And I think one thing you have to recognize about me, I think you'd agree with this, I've never used the everything in the kitchen sink approach. I've tried to really target my response to get information that we would actually use. So my oversight letters have been very focused on issues, asking for just information that I believe the American people deserve. I want to ask you, if you would get the response I've been getting, which is basically, we're not going to respond other than refer you to our website. Does that happen to you in your investigations?
Well, actually, on occasion, we have had problems, and I agree, we push back, and we push back hard, and oftentimes I've been in front of this committee on multiple times, including when you were chair, to talk about those issues, and I agree you deserve and are entitled to answers. We're, as you know, very responsive to you and your staff, as well as other members here, because it is important for Congress to be able to get the information it needs to do the oversight it needs to do.
Just a brief list of some things I've asked questions about. By the way, I think our biggest blunder was we didn't put enormous time and effort and resources into exploring and researching early treatment. In fact, we sabotaged early treatment. But I've written letters. How much should we expend? What were our efforts? I don't get anything. We have requested the emails from Dr. Fauci unredacted, 4,000 pages. We don't get them. We've been given access to about 400 in dribs and drabs, 50 pages at a time. We don't actually get them. We have to review them in camera. I've asked questions. What did the FDA do in August of 2021 when they extended the emergency use authorization for the vaccine that's available in the U.S. and granted full licensure on one that's not available? What was that all about? It was confusing. I get no answer whatsoever. Why haven't we acknowledged and explored natural immunity? Why haven't we factored that into these idiotic and pointless vaccine mandates? One of the more recent ones was information on the Defense Department's DMED database that showed a 3 to 10-fold increase in different diagnoses of cancers and things like myocarditis and neurological problems. The DOD, by the way, did respond to a PolitiFact request before they ever responded to me in a very inadequate way. But what they said is, oh, we recognized a glitch in our system. What we have is from whistleblowers, doctors, military doctors who were seeing vaccine injuries. They did an analysis the previous 5 years versus 2021. And again, they saw a 3 to 10-fold increase in these diagnoses. And so what the DOD told us is, oh, we were wrong for the previous 5 years. And all of a sudden, they've given us some data where those things shot up tenfold. What's pulling off here? They're not showing us the data. But I think one of the more troubling ones, and why don't you put up my chart here, very early on in the process, again, I was a big supporter of Operation Warp Speed. Now, I'm not anti-vax in any way, shape, or form, but I think you have to take a look at the data coming in. And the data coming in was concerning to me. Now, I was asking questions back in March, April, May of 2021 when the VAERS were showing 2, 3, 4, 5,000 deaths. Today, we're up to over 25,000 deaths reported in the VAERS system. 1.168 million adverse events. And what this chart shows is comparison, for example, ivermectin. You're not supposed to say that word. By the way, New Hampshire, I guess, their assembly just approved over-the-counter use of ivermectin because it's pretty safe. 15 deaths on average over 26 years on the VAERS system. Hydroxychloroquine, 70 deaths. Annual flu vaccine, 78 deaths. Remdesivir now, 1,721 deaths. COVID vaccines, 25,158 deaths. Again, now I realize VAERS doesn't prove causation. 29% of those deaths are occurring on days 0, 1, or 2 following vaccination. It's something I'd be concerned about. So I write the FDA, I write the CDC, I write NIH. What's happening here? I ask them about their other surveillance systems. I get no information whatsoever. It's not that I don't get information, the American people don't get information. The reason our healthcare agencies have lost, the American people have lost faith in our healthcare agencies is because they have been completely non-transparent. They've not provided the information that we're getting from other public health agencies from around the world. We've had to look to Israel, we've had to look to the UK to find out what's happening here. So I guess the plea I'm making to this committee, the chairman of the permanent subcommittee in which I'm ranking member, is this needs to be investigated. If the agencies don't respond to us, we need to issue subpoenas. Congressional oversight is almost a joke nowadays. You can do investigations in the Department of Justice. You can do pretty good investigations in the IG's office. Congress, the agencies just thumb their nose at us. And in so doing, they are thumbing their nose at the American people. This is outrageous. It can't continue. And Mr. Chairman, I'm calling on you as chair of this committee to start strengthening our ability to get information out of these agencies. It is outrageous what has been happening, our lack of information, lack of transparency, the lack of honesty coming out of our healthcare agencies. This is a scandal. The fraud, the hundreds of billions of dollars probably sent to people that didn't need it, is a scandal. But this impacted people's lives. We need answers, and we need answers now. Thank you, Mr. Chairman.
Thank you, Senator Johnson. Senator Hassan, you are recognized for your questions.
Well, thank you so much, Mr. Chair and Ranking Member Portman, for this important hearing. And thank you to all the witnesses for your critically important work to prevent waste, fraud, and abuse of taxpayer dollars and to improve management of pandemic relief programs. I want to start with a question to you, Inspector General Horowitz, and then to Controller General Dodaro. To date, the GAO and Inspector General community have made hundreds of recommendations to federal agencies on how to improve their response to the pandemic and ensure that relief funds have the maximum benefit. However, as of December 2021, agencies have implemented less than 1 in 5 GAO recommendations. And Inspector General Horowitz, you talked a little bit about some of this with Senator Portman, but in your review as chair of the Pandemic Response Accountability Committee, or PRAC, what more can agencies do to address IG and GAO recommendations that could help them curb waste, fraud, and abuse of COVID-19 relief funds?
Senator, so as you indicated, IGs have issued hundreds of reports now to date. They include hundreds of recommendations in them about how to improve oversight, how to improve programs. And you're right, the track record of agencies in implementing them has been uneven, I would say at best. Some perhaps do better than others. But one of the things we do now as in the IG community is make that information public. So on oversight.gov and on IG websites, we are trying through making the information public where agencies stand in implementing them in an aging list. So you can see how long it's taken them to do. Our strongest tool in that is, to get that done, is not only speaking and elevating it within the agency, but frankly talking now more frequently with OMB leadership so that they can do what is the tools that they have available to them to try and push agencies to more promptly implement these recommendations.
Well, thank you. And Controller General Dodaro, what recommendations should agencies prioritize to maximize the effectiveness of their pandemic response in a cost-efficient way?
I've sent letters to every head of every department and agency in the federal government with a priority list of recommendations. Okay. Those have been provided to the Congress. They're public on our website. I've met with all the new leadership of the departments and agencies, urged them to do that. In some agencies, we have regular meetings to focus on the progress in implementing our recommendations. In other agencies, not so much, particularly HHS. And so I'm disappointed at the pace. Like Mr. Horowitz said, we've been working with OMB, and I have regular meetings with the White House coordinator, Gene Sperling, on this to try to enlist their support to get the agencies to move faster in implementing these recommendations. I do believe additional congressional attention to this matter would be very helpful. I've also used the high-risk list. You know, when I was here last March, I mentioned that I put the emergency loan programs of Small Business Administration on the high-risk list because it's not only our recommendations, they've failed their audit the last 2 years. They haven't been able to get a clean audit and show the proper accounting of this money. I've also added HHS's leadership and coordination in January as a high-risk issue. Clear roles and responsibilities aren't there. There's not a lot of clear communication. There's not, and these have been problems for decades. Okay. So I'm doing everything that I can, but I could always use extra help.
Right, and we can return to that priority list and see if we can focus on it too, because I think that's important for us all to be speaking with one voice to prioritize the best ways to have the most efficient and most impactful results. Let me turn to you, Inspector General Turner. Single sign-on technology allows users to create one username and password to securely access many different websites. This is not just convenient for consumers, but it can also prevent fraud when single sign-on technology verifies users' identities. For example, during the pandemic, some states managed access to pandemic relief applications through single sign-ons using identity verification. States that use these tools experienced a significant decrease in fraudulent claims and were able to prevent billions in improper unemployment insurance payments. So, Inspector General Turner, how could the Department of Labor work with state partners to implement these identity verification tools across the country?
That seems, Senator, that seems like something that the state workforce agencies would be able to share in terms of best practices. Yeah. And I think that's something that we could probably pass on to them as well as the department could. The department, part of them reducing the possibility of fraud is just also sharing best practices across the government. There are like 53 different entities, so they have their own way of doing business. Right. and sometimes you have some that do a better job than others. But I think if they could just kind of share that information, and that's something that I will pass on to the department.
Well, thank you. I want to turn to Mr. Miller on some of this same issue. Last September, the Technology Modernization Fund awarded $187 million to the GSA to expand its single sign-on service, login.gov. Part of those funds are intended to shore up login.gov's identity verification capabilities. It's a mouthful. How could these identity verification tools help the federal government prevent improper payments, not just of COVID-19 relief funds, but of payments that the government makes daily?
Thank you, Senator, for that question. And login.gov is an important tool, but it needs to be strengthened going forward. This is something that we're working and looking actively at. To Mr. Turner's point, when you looked at those 53 different systems, some of them weren't using identity verification for reasons like they couldn't afford identity verification tools.
Right.
And the end cost of that was substantially larger than what the cost of identity verification on the front end. Second thing on this is right now we largely leave agencies and states to their own devices to determine how best to do these. We need stronger tools in place on identity verification. That's why we're investing in login as a potential option. And it's a topic that we're working hard on at OMB.
Well, thank you. And Mr. Chair, if I could, I just want to follow up for one short bit on that, because some federal agencies such as IRS, the VA, and Social Security already partner with private single sign-on companies to verify customer identities and prevent fraud. So how can OMB work with the GSA as well as GAO to ensure that its efforts to expand identity verification through login.gov doesn't overlap or duplicate the existing agency efforts here?
Right. So one thing that we want to make sure that we're putting in place is clear standards and guidelines for agencies as they're moving forward, so that we have strong identity verification tools, while also ensuring that those tools are allowing access and protecting individuals' privacy.
Thank you very much. Thanks for the extra time, Mr. Chair.
Thank you, Senator Hassan. Senator Carper, you're recognized for your question.
Thanks very much. Welcome. Some of you are not strangers to this committee, and we're delighted to see those of you who might be here for the first time or those who have been before us many times. Thank you all for the great work that you do and for your leadership. I'm just wondering, Mr. Turner, do you remember when you were sworn in as the Inspector General of the Department of Labor?
That would have been December the 7th, 2021.
And does that date have any special meaning to you? When you think of, besides for being sworn in, does there any other special meaning?
Not that I can think
of. Well, it's
of.
Pearl Harbor Day. That was the anniversary of Pearl Harbor Day, when we lost so many men. I'm a retired Navy captain, so for my family, it's something that's real. For the people in Delaware, it's also real in another way. It is the day that Delaware ratified the Constitution, became the first state to ratify the Constitution. And for one whole week, we were the entire United States of America. And then we opened up and let in Maryland, Pennsylvania, and the rest. I think it's turned out okay for the most part, but it's still early. Still early. If you look at the preamble of the Constitution, here's where I'm going with this. It starts off, as you'll recall, we the people of the United States, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty. And we're talking about here a response of our country, our people, over the last 2 years to really, in a way that's consistent with the preamble of the Constitution, promote the general welfare and secure the blessings of liberty to ourselves and our posterity. So it's an important work, and it's consistent with what our founding fathers, the framers of the Constitution, had in mind. I have a couple of questions. I probably wouldn't have time to ask all of them, unless the chairman just wants to require everybody else to yield their time to me, which is probably not likely. But my first question would be of you, Mr. Miller. Over the last couple of years, through 2 administrations, Congress has approved about $4.5 trillion, I'm told, to support COVID response and recovery efforts. So far, agencies have obligated $4.2 trillion. I'm not sure how far back we'd have to go in our nation's history where that's actually more money than we would spend in a given year through the federal government. It's probably not all that far. It's a huge amount of money and requires a lot of oversight. And we want to thank all of you and the folks who work for you, with you, for leading the oversight efforts and for testifying today. Mr. Miller, we learned a lot about the federal and state technology systems, staffing, resources, and communication processes during the pandemic. We're still learning. My constituents would tell you that we learned a lot about what didn't work, as well as what did. And in your testimony, you outlined a number of steps the administration is taking to improve communications and access across the federal government and execution across the federal government. With that said, state and local governments are responsible for implementing, as you know, many of these programs. How is the administration ensuring they have the necessary support and sufficient communications with federal agencies? That would be my question for you, Mr. Miller.
Great. Thank you for that question, Senator. Yes, state, tribal, local, territorial governments are critical in successful implementation. Open communication channels, both at an agency level, an administration level, and a program level, are important. Certainly, this is something that Treasury has done and is well underway in terms of implementing the programs over the course of pandemic relief. We're also taking steps on this as we're implementing the Bipartisan Infrastructure Law, where that specific set of investments is almost entirely reliant on states, localities, tribal, and territorial governments. One additional way, in partnership with the oversight community, that we're trying to make sure that we have strong collaboration and coordination is not just with those executing the programs, but with those who are auditing and investigating the programs so that they have the information that they need to protect program integrity and support states and localities in executing these programs.
All right, thank you for that response. My second question would be, Mr. Turner, for you, LDT. Mr. Turner, the question deals with improving the unemployment insurance program, something that some of us in this committee give this a lot of time and attention to. But Mr. Turner, I have a wonderful constituent services team, blessed with them. They work every day hard to advocate for Delawareans seeking help, but including federal assistance. The top issue we hear about is delays in processing unemployment insurance claims. That may be the top of the charts in terms of complaints that we hear from our constituents. These delays predate the COVID pandemic, but the pandemic has certainly exacerbated this particular issue. You noted in your testimony ongoing challenges with states having sufficient staffing and system resources to manage UI claims. You also noted in an earlier unsuccessful attempt by the Department of Labor to help states modernize their legacy IT systems through federal funding. Why didn't this work? Why didn't this work? And what lessons has the Department of Labor learned from this effort?
Well, let me first say, and thanks for the question. First, we've been identifying for the last 20 years, Labor OIG, some of the problems that are existing now with COVID. These are problems with lack of IT modernization. A matter of fact, about around 2010, there was $7 billion that was dedicated and funded for states to modernize their systems. And in most cases, they didn't. In some cases, I think about of the $7 billion that was set aside for that, only $4 billion was actually used. About $2 billion was used for to pay benefits, which was allowed. But I think this should have went towards the modernization. And so those were some of the challenges. But when we look at the work that we've done the last 20 years and to include 10 years ago, we find some of those same problems. And those problems actually added to the explosion in terms of lack of support for claimants during this COVID. So those have been some of the challenges. Also, I think the bigger thing was that a lot of the states were not adjusting to the new UI care packages, in a sense, because some of them were different. Like I give you example, the gig from the PUA, that was different because this was talking about, in some cases, gig workers, self-employed workers, and there was different requirements for those workers. And so in some cases, there was just not the safeguards that had been in the normal UI program.
Okay. And Mr. Chairman, if I could, just for the record, a question, I'll state the question and then ask you to respond, Mr. Turner, for the record. How can Congress and the administration work together to effectively help states address staffing and systems shortfalls moving forward? And the last thing, just for the record, a question, there has been a good deal of conversation about data gaps that are challenging effective oversight. What steps is the administration willing to take to address these gaps, and how can Congress help? And again, our thanks to all of you. I hope you feel welcomed here. We very much welcome you, and I think you know that in your teams, the folks that are sitting behind you and those that you represent. God bless you. Thank you. Happy St. Patrick's Day, even if you're not Irish.
Thank you, Senator Carper.
We're lucky. We're lucky to have you in our service.
Thank you, Senator Carper. Senator Hawley, you're recognized for your questions.
Thank you very much, Mr. Chairman. Thanks, everybody, for being here, to the witnesses. Mr. Miller, if I could start with you. I want to try to understand what's happening with the Special Inspector General for Pandemic Recovery. This is, as you know, position that this body, Congress, created when we passed the CARES Act several years ago now. The Senate confirmed a nominee to lead that office. Multiple senators have referred complaints to that office. For example, on July 15, 2020, Senator Warren wrote to SIGPER calling for an investigation into a COVID lobbying palooza, those are her words, and stating her understanding that SIGPER was created, I'm quoting her again now, to investigate any fraud, waste, and abuse of Coronavirus Aid, Relief, and Economic Security Act, CARES, funds. On August 6th of that year, 2020, 28 other senators, that includes me, wrote to SIGPER requesting an investigation into 43 Planned Parenthood affiliates that applied for and received CARES Act funds through the Small Business Administration's Paycheck Protection Program, despite clear rules against that. My point is that multiple senators have referred multiple things to SIGPER. It's in the legislation. However, the Biden administration and DOJ, in consultation with OMB, stripped SIGPER of almost all of its jurisdiction pretty much as soon as it came to office in April of 2021. I'm trying to understand what's going on here. I mean, why has SIGPER been stripped of its jurisdiction? Why is it not able to perform its mandated functions? What's happening here?
Senator, thank you for the question. To clarify on this issue, so the disputes that you're referring to go back into the prior administration with regards to SIGPER's authorities. SIGPER went to OLC, the Office of Legislative Counsel at DOJ, which makes determinations for the executive branch regarding authorities when there are disputes within the executive branch. OLC consulted with OMB informally, as it would on any matter where it felt OMB's input would be useful. OLC determined that the legislation had specific authorities for SIGPER, and the executive branch follows what OLC determines.
So you're saying that OMB did not recommend that SIGPER be stripped of its jurisdiction? Is that your testimony?
OMB answered questions and input from OLC and did not make a determination. OLC made a determination.
Will you provide us with records of that communication?
As occurred before my time, I would welcome follow-up discussion.
I'm just saying, wait a minute, the OLC OMB communication occurred before your time? It occurred under this administration, though.
I was sworn into office at the end of April.
But it occurred during the Biden administration, right? I don't particularly care when you were there. I care when it happened, and I care that you're there now and have some authority. So it doesn't matter to me when you are in office or not. It matters to me that you're before this committee, that presumably you've sworn an oath to answer to this committee the questions, and I'm asking you a direct question, whether you will give us the communications. I don't care if you were there or not.
I would welcome follow-up with you on this, Senator Hawley.
Is that a yes or a no or a maybe? Here's the deal. I want to know why in the world this administration has taken an act of Congress and gutted it. And that's what they've done with SIGPER. You've gutted it. And there are trillions of dollars that have, let's just review. The CARES Act spent more money than we spent on World War II. And we have no effective oversight, in my view, of how that money is being spent when it comes to waste, fraud, and abuse, because this administration has chosen to gut the IG system that was set up to oversee it. And I want to know why. And I want to know if we can get the information from it. That's my question to you.
This administration has taken active steps to reassert the role of IGs in providing oversight.
SIGPER?
OLC made a determination with regards to SIGPER's authorities. In 2020, actions were taken to undermine the IG community. We believe that IG roles...
Indeed, actions were taken to undermine the IG. In April of 2021, this administration gutted this IG. They gutted the IG that we created, that Congress created on a bipartisan basis, and that bipartisan groups of senators have referred information to. And now this entity can't carry on its work because your administration gutted it. So let me come back to my question. Will you provide this committee the communication between OLC and OMB regarding the decision to gut SIGPER?
If you are welcome to request.
I'm requesting it now. That's what I'm doing.
We will look into the specifics of the communication and absolutely get back to you on that.
So is that a yes?
I would like to look into the specifics of the communication.
Yeah, that sounds like frankly, a non-answer to me. And unfortunately, that's been the case for a year now, since this administration gutted SIGPER. I've introduced legislation that would restore SIGPER's jurisdiction and restore its funding. Frankly, I think it's being funded on a shoestring budget. It needs to be funded more than it is. It needs to have the full resources to carry out its mission to oversee waste, fraud, and abuse and get to the root of it in this a huge amount of spending that we did for an unprecedented crisis. But to do that amount of spending and to get the fraud reports that we've been getting and to not have SIGPER funded and with its jurisdiction fully intact, to me, is totally inexplicable. And I continue to be amazed that the administration is doing this. So I'll follow up with you, but frankly, I'm disappointed in your answer. Let me ask you about something else. Yesterday, the New York Times reported that the Biden administration is taking $377 million in federal emergency housing aid from states mostly controlled by Republicans, I'm quoting from the New York Times, and redirected that cash to states that have already used their allotted money, including New York, California, and New Jersey. Is there statutory authority for this?
I'm not familiar with the specific decision that you're referring to, but I'm happy to follow up with you on it.
So it's right here. Treasury shifts $377 million among states as pandemic housing aid dries up, from the New York Times. It's about the $46 billion in emergency rental assistance that this program enacted back in 2020.
It's a program that's critical to keeping people in their homes.
And so my question to you is there statutory authority to shift around almost $500 million from one state to another without the state's consent?
I would expect the Treasury only take action consistent with statutory authority. If they didn't, it would be inappropriate.
Okay, so that's a yes. You think there is statutory authority? What would it be? Can you direct me to the?
I would be happy to follow up with you on the specifics. Again, if Treasury took action that was inconsistent with statutory authority, that would be inappropriate, and I would hope that Treasury's IG would say so as well.
My time has expired here, and there are other senators who want to ask questions. I have a few questions for you, Mr. Turner, about some of the things that you have discovered in terms of delays and providing disaster relief. So I'll get those to you for the record. Sure. And thanks for the work you're doing. Thanks to you all for being here, and thank you, Mr. Chairman.
Thank you, Senator Hawley. Senator Padilla, you're recognized for your questions.
Thank you, Mr. Chair. I appreciate the participation of all the witnesses here today. Let me begin by uplifting a dynamic of disparities. You know, there's been a lot of talk in recent years, and not just relative to COVID, but because of the impacts of COVID, responses to COVID, a lot of the pre-existing inequities in our society have been exacerbated, frankly. So although underserved communities in many ways experience disproportionately the harms from the COVID pandemic, from a health perspective, from an economic perspective, and more, federal relief programs often fail to reach those most in need. Federal legislation enhanced unemployment insurance benefits, for example, and expanded eligibility amid the severe economic shock caused by the pandemic. However, during the first year of the pandemic, Black and Latino applicants were less likely to receive unemployment insurance benefits than white applicants. We have the data that tells us that. Additionally, a UCLA report found that the first distribution of loans through the Paycheck Protection Program actually widened pre-pandemic racial inequalities by supporting far fewer jobs per resident in Black and Latino neighborhoods than in white neighborhoods in California. I'd be shocked to think that it was an isolated dynamic to California alone. Now, these disparities are certainly not new, as I mentioned, but the COVID-19 pandemic certainly exacerbated them. And it's particularly disconcerting that federal relief programs may have made disparities even worse. Proud that the American Rescue Plan included language that helped put equity front and center as part of our recovery efforts. But we need to make sure that its implementation actually improves upon those underlying inequities. So my first question is for Deputy Director Miller. How is the Biden administration using COVID relief efforts and other federal funding to address these underlying inequities?
Thank you, Senator. Thank you for the opportunity to talk about these efforts. As I noted in my opening remarks, the pandemic disproportionately harmed underserved communities, and too often relief didn't reach those intended. One of the early actions of the administration was making adjustments to the PPP program for the items that you noted that were widely and publicly reported in terms of access to PPP loans for some of the smallest and disadvantaged businesses at a time where Black-owned businesses were closing at twice the rate of other types of businesses, making sure that they had access to PPP. Another thing that we have done with regards to implementation of ARP is on the front end of programs, bringing together, as I noted, the gold standard meetings with agency IGs, the PRAC, OMB, the ARP implementation team, and agencies, so that we're taking steps in program design, ensuring that both relief is targeted where intended, and that we're putting in place reporting mechanisms that get the right balance between ensuring that we're getting the outcomes that we need while reducing burden for applicants.
No, definitely acknowledge the progress that's been made on thinking about this on the front end, and certainly hope that it becomes institutionalized and baked into efforts going forward across the board. Next question is for Chair Horowitz. Just like to ask what recommendations you may have for how the federal government can better ensure that underserved populations are prioritized for funding and resources.
Yeah, Senator, thank you for the question. One of the challenges we found, again, is the data gaps here. What we've seen is we've looked to see how have underserved communities been advantaged by these programs or disadvantaged by these programs. We're finding there's a lack of data. We're not sure what the backgrounds are of those who've gotten the loans. We're not sure about the economic status of individuals who've applied. And it's been one of the things we've reported on, and we've actually held hearings on about some of the challenges in us even trying to figure out how that came about. So I think one of the first things is agencies making sure they get data. Another is what GAO found in a report they did about PPP and the furtherance of the PPP program by ensuring that community development financial institutions were available to distribute loans. That was an important step forward, very important GAO report in that regard. Also, with regard to how programs were run, operated, and money was distributed. What we found is those who didn't have internet service, those who didn't have the ability to apply through the process set up, couldn't get it. And that harms mostly those in rural communities and in underserved communities generally because of broadband issues.
Right. No, and that's a classic example where it might have been well-intentioned, not completely thought through, efficiencies to be gained by being primarily digital, but without recognition of, yes, the digital divide is still alive and well in America. We are only worsening those pre-existing gaps and inequities.
Can I add one other, which is
Please.
The fraud we've talked about? It not only victimizes the program, but particularly for several of these programs, it victimizes those who they were intended for, which often are those most in need. Right. And what we've heard, we actually had a meeting about this just the last couple of weeks on the identity fraud, identity theft issue. We heard from representatives of underserved communities about how what happens is after when people in underserved communities seek to apply for those benefits that they're the ones legitimately entitled to, but their identities have been stolen, it turns out they're the ones being questioned as if they're the fraudsters. Mm-hmm. They're the ones that struggle to get their identities back. And so that's actually a very big issue. When we talk about identity theft, we think about how the programs have been defrauded, but they harm the people whose identities were stolen.
And I'd love to follow up with you on what we're doing after the fact to assist those who have been victims of identity theft, as opposed to, sorry, we're going to make this hard for you, and we leave them on their own to figure it out. I know my time is limited. I do want to put one more issue on the table here, and that is the use of facial recognition, and more specific to how it's been brought up earlier in the hearing. As we continue to combat fraud, to your point, in federal programs, it's important that our efforts to provide program integrity do not come at the cost of privacy and accuracy. I recently joined Senator Menendez and other colleagues in sending a letter to the IRS highlighting well-documented concerns about the use of facial recognition technology, especially for individuals who have poor internet service at home, who rely on computers in public libraries, for example, or who use older phones, or for whom English is not their first language. I'm pleased that the IRS has taken initial steps to transition away from the use of facial recognition technology to verify identity. However, given the gravity of the threat to civil rights and civil liberties by this technology, especially against immigrants and people of color, other vulnerable communities, I remain concerned about the continued use of this technology and the vast amount of biometric data that agencies and contractors are managing. Question for Comptroller Dodaro. How do you think agencies can best uphold the integrity of the programs without undermining the civil rights and civil liberties of program beneficiaries?
Well, they have to make sure that they first address those issues. They recognize what those issues are and properly address it. They need to go through the due process of hearing from different people, but you have to understand the technologies. In facial recognition, a lot of agencies are using it now, mostly in the law enforcement communities. We've made several recommendations about this, and some of the technologies have built-in limitations in them. So you have to understand the limitations in the technology, particularly for people of color, for facial recognition technologies and others. So there are ways to do it, but it has to be a very thorough, deliberative, careful process to make sure that it's only used with proper understanding of not impinging on people's civil liberties.
Yeah, look, we obviously have a lot to follow up on there and a deeper dive on specifics. I would argue just because it is in more widespread use among other departments, other agencies, other sectors, not just the federal government, doesn't mean it is not problematic in those areas as well. So let's not point to, well, it's being used in law enforcement as to a reason to forge ahead without the thoughtfulness
I understand
required.
that, and that's what I'm saying. I'm saying that even in law enforcement, it needs to be careful. We've made recommendations on making sure people understand the information that they're getting. But if you go outside that area, you need to have due care. So we're in agreement on that.
All right.
And can I just add one thing on that? Because there has been a lot, and there is a lot to be concerned about here, but it can't also paralyze us and agencies from taking steps to prevent identity fraud and identity theft. And there has to be that kept in mind. There's oftentimes this, we can't use this tool, so we'll stop trying. And I just encourage, because it has such wide ramifications, the identity theft. We've seen it endemic in these programs over the last 2 years, and it's hurting those who the money should go to.
Thank you. Thank you, Mr. Harris.
Thank you,
Senator Padilla. Senator Scott, you're recognized for your questions.
Thank you, Chair Peters. This is an important hearing. I want to thank everybody for being here, and I want to thank each of you that I've read your reports, and they're very, very helpful, and thanks for working with my office to get us information. My first question is for Mr. Miller, and it might have been asked before. I wasn't here for the whole hearing. The Biden administration asked for another $30 billion in COVID relief and didn't ask that it be taken out of unspent COVID dollars. And if you look at the numbers, I think it's hundreds of billions of dollars that is unspent. Can you explain why the Biden administration doesn't think we should use unspent dollars?
Sure. So 90% of pandemic relief funds have been obligated. The administration requested $22.5 billion in funds for additional action to support our needs going forward, vaccines, tests, treatments, supporting the uninsured, like other emergency funding. We don't believe it needs to be offset. We think this is absolutely imperative, and we'll work with Congress, and OMB would be happy to provide technical assistance to you and Congress to move forward.
One thing I've been up here 3 years, and I've been talking about this excessive government spending is going to cause inflation, and I'm concerned about the federal debt. The Committee for Responsible Federal Budget recently found that ongoing COVID relief under the Biden administration is definitely contributing to inflation. They estimate these ongoing COVID programs will cost $160 billion this year and cause a rise in the CPI inflation rate by 68 basis points if these policies continue. So, Mr. Miller, could you talk about exactly where we are with CPI and PPI and what the Biden administration is doing to bring inflation down?
Sure. I think first, stepping back, when you look at GDP, over the last year, it was at 5.7%. Unemployment rate is down to 3.8%. It was the largest year of job growth on the record. So we have strong overall economic performance, but real challenges, absolutely, with rising prices. The president laid out 3 actions to deal with that. Supply chains, which throughout the pandemic have continued to create challenges. The second, competition, making sure that we have appropriate competition in the market to drive down prices. And third, investing in things that matter for families that are impacting their bottom lines, like prescription drugs, like childcare. And of course, the Fed plays an important role with its dual mandate, stable prices, full employment.
Can you talk about, do you know where CPI is now and PPI, what the numbers are now?
Yes, the number was quoted earlier by Senator Portman, 7.9%.
And what is it?
7.9%.
And how about the federal debt? Can you talk about where we are now and what do you think ought to be happening with the federal debt?
I think the president's been clear on this. We're putting forward budgets that are responsible, where increased spending proposals and tax cuts are paid for. That was true with the FY22 budget. That will be true for the FY23 budget.
So what's our debt now?
It's over $20 billion.
And
$20 billion, yes.
So also, can you talk about deficits? I think the Biden administration has run significant deficits. Can you talk about what the deficit was last year and what you anticipate, how you anticipate to reduce it?
So deficit is on its way down. The most important thing is driving an economic recovery, putting forward budgets that are responsible, as this president is committed to doing. Those are going to be our steps.
So, the deficit was $2.8 trillion. You realize, that's the second biggest deficit in the history of the country.
Yes.
This is not sustainable. It's my understanding that the Biden administration made the decision to not require the states to go after individuals that committed fraud with regard to the unemployment under COVID. Is that accurate?
That is not accurate. States should be going after individuals that committed fraud under the unemployment insurance program.
Okay, so there's nothing the Biden administration has put out to tell the states that they don't have to go after people for unemployment fraud.
If somebody has committed fraud, someone should go after them. Okay. We should put resources behind doing it.
And if states didn't do the right thing to watch how the money was spent, do they owe the money back to the federal government?
So the states, clearly, these systems were overwhelmed. Systems were fully overwhelmed. They were underfunded. They were under-resourced, period. We saw that. We saw huge claims backlogs. We saw people attacking these state systems. We put money into the unemployment insurance system, critical lifeline for millions of Americans. But clearly, and you saw this with the rise in improper payments, it showed that we need to fix these systems. And one thing that I hope that we can do together is really take a serious look at how are we going to fix these systems. I believe the Comptroller General talked about the number of years of which we've had improper payment rates at inflated levels in UI, and we need to fix it going forward.
So will the Biden administration go after states that violate the law?
States that violate the law?
If the states didn't comply with the law, are you going to go after them?
The president doesn't have any tolerance for fraudsters. He doesn't have any tolerance for not complying with the law.
So if states decided to allow people to go on unemployment even though they were employed, gainfully employed, the Biden administration will go after those states for allowing that to happen?
You have a combination of actions that happened during the early stage of 2020, where you had overwhelmed systems. You sometimes had undertrained employees making substantial numbers of mistakes. Sometimes someone who is eligible making an overpayment or an underpayment, and other times an individual committing fraud on the system. We should go after the fraudsters first and foremost and dedicate our resources accordingly.
And if anybody intentionally and didn't enforce the law, you'll go after them also?
If someone identified that there is fraud, and they should go after those who are committing fraud.
But somebody intentionally didn't enforce the law, will you go after them? If a state decided not to enforce the law?
If the state decided not to enforce the law.
Right. If they decide to say, they're going to let people go on unemployment, they did not have any right to go on unemployment. That is against the law.
If that individual fraudulently obtained dollars through the unemployment insurance system, then yes, they should be prosecuted accordingly.
Mr. Turner, I'm thankful the OIG initiated an audit of the department's oversight of unemployment insurance integrity activities, and your team does a great job. Is your ongoing investigations into the pandemic-related unemployment programs, or in your investigation, what have you uncovered so far?
What we've uncovered is that, again, to go with what Mr. Miller mentioned, there's been a lack of training a lack of modernization, and in some cases that there's been uneven distribution of the rules and regulations when it comes to unemployment fraud by the states, because it's obviously 53 entities.
So is it accurate that the administration issued guidance to the states saying they are not required to recoup erroneously dispersed funds?
No, I have not seen anything. I know they put out a waiver that the department has recently sent out, and that waiver specifically stated that fraud would not be tolerated.
So do you believe the administration is going to go after states, the people that erroneously collected unemployment?
I would expect they would. We plan on putting that on our audit in terms of looking at that area.
Okay. All right. Thank all of you. Thank you.
Thank you, Senator Scott. Votes have been called. I'm going to proceed to vote. Senator Rosen will take the chair. And prior to her moving over here, Senator Lankford, you're recognized for your questions.
Hey, Mr. Chairman, thank you. Thank you to the witnesses. Thanks for being here. Mr. Miller, I want to follow up as well. Senator Scott had mentioned before that there have been some questions just on spending and where things have, what has happened already with the spending that's occurred, what's left of different accounts. You had mentioned before you didn't feel like some of the new spending for COVID needs an offset. We're still trying to get answers to questions of what has been spent in what category. So some pretty basic things. Obviously, COVID vaccine acquisition, the distribution of the COVID vaccine, research and development for COVID vaccine, test production, test acquisition, therapeutics production, acquisition, PPE purchased. I mean, those are pretty standard questions to be able to go through on it, to be able to get total dollars, be able to see what's been spent from each account, and then what is unspent on it. How could we best get those totals?
Sure. So first, overall, over 90% of funds have been obligated across pandemic relief efforts. USAspending.gov, as well as the pandemicoversight.gov, captures spending by recipient, by state. In addition to that, at the request of Congress, OMB has been providing ARP balances, ARP obligations to budget committees, both parties. Some specifics, $30.4 billion spent on COVID-19 vaccines, $13.5 billion spent in vaccine support like distribution, tracking, promoting vaccine. Happy to provide that information. Senator Romney also sent a letter to the White House, as you may be aware, along similar lines.
Right. So we're trying to figure out, can we also get what has been spent versus what is obligated?
Yep. And we sent a response to him with regards to the specifics, going through some of the key categories. Those online, our USAspending.gov has obligations as well as outlays in terms of what's been spent. I would note one of the things that is an important distinction in some of the funds that have been unobligated, they may have been allocated. So, for example, the biggest bucket with an ARP is the state and local relief fund at the Treasury Department. And because it was tranched, a lot of states and counties know the amount of money they're expected to get, and those tranches and the dates are defined in the statute. That means in most cases, they have actually budgeted for those resources, even though they have not yet been obligated.
Do we have a listing of what has been reprogrammed?
Do we have a listing of what has been reprogrammed? I would be happy to follow up with you on the specifics of a question around.
Be helpful. I mean, there's multiple different categories. We hear that monies were reprogrammed into other areas. For instance, HHS moved money over to ORR, Office of Refugee Resettlement, dealing with the unaccompanied minors. We're trying to get details of what has been reprogrammed, where were those reprogrammed. DHS has been particularly difficult to be able to get reprogrammed dollar amounts, and what has been moved from HHS down to the border. We understand quite a bit was moved to the border. Obviously, there are pandemic issues related there as well, and they're still ongoing. But we're trying to be able to figure out what was actually reprogrammed and sent down there. Can we get a listing on that?
I'm happy to follow up with you.
It'd be helpful. Gene Dodaro, good to see you again.
Good to see you, Senator.
Thanks for your extended work for so many years and so many things. There are lessons to learn from this as we go through. One of them, it deals with a topic you and I have talked about for years, and this is taxpayers' right to know, that OMB has been very engaged in trying to be able to apply. OMB has been engaged in trying to be able to determine categories to be able to list out for taxpayers' right to know. That's an ongoing work behind the scenes for them that I think they're doing a really good job on trying to get done. There's a lot of challenges in that. Are there lessons we can learn from trying to categorize things through COVID relief to be able to develop buckets of money in categories that could be transitioned into lessons learned for long-term for taxpayers' right to know application?
Yes. I mean, I think there's always lessons to be learned out of these activities. And I think the main thing, though, that I'm concerned about that I've been trying to deal with is getting more timely information, regardless of the categories.
Right.
This could help on the categorization, particularly for emergency spending, and they could adjust the codes that they use to code with Treasury on the money. But part of the problem is that to get the information you're requesting, to get it up to date, you got to get it from each individual agency. It's not on usaspending.gov, and it's delayed, and so you really don't have that information available. And so to me, the timeliness of this. Now, in the Recovery Act, when that was passed, the lesson learned out of that is you had direct recipient reporting to a website.
Right.
You didn't have to go through the agencies. In this case, that was not used as the important part of this. And we're still going to have trouble finding out what the states did with the 2 funds that they had, because they're going to distribute it to subrecipients. There's no auditing done of subrecipient data. And one of the recommendations I make in today's testimony is to have the IGs, their requirement for auditing the data on usaspending.gov has expired. And unless Congress reinstates that requirement, very few IGs will audit the data. So the quality and completeness of the data is still at risk. Of 57 or 56 entities that the IGs looked at, 44 IGs found problems with completeness, accuracy of that information. And so that needs to be a requirement. And nobody's auditing the subrecipient data. So I'm going to take a look at what we can do at GAO, working with the IG community or whatever. So the basic lesson learned out of all this is better categorizations, as you suggest. And I think we learned some things on that, particularly not only coding the spending data, but the procurement data and the systems. We've had some recommendations on that. But the main thing is the quality, the completeness, and timeliness are still major issues for all federal spending.
Because we can get a big category and say X amount of dollars have been allocated, but trying to be able to get what it was spent for, where it went, how it went, was it actually used for that purpose at the end of it, we're not able to see at this point.
No. And you need better systems. I mean, one of the other recommendations that I recommended today statutorily is that Congress reaffirm the requirement for OMB and the agencies to have 5-year system modernization plans. A lot of the systems, financial management systems, aren't able to produce that type of timely information. They can do it once a year to get an audited financial statements, but to get the type of data, real-time data that you have, we need better systems. There needs to be better plans to get there.
Right. Yeah, we can't do oversight of what we can't see. And to go back to Mr. Turner's comment earlier, billions of dollars were allocated to states years ago to be able to improve their unemployment systems, and those dollars weren't actually allocated actually improving systems. Right. Then every state was hammered in 2020 and trying to be able to figure out how to be able to deal with this. Secret Service and everyone else is engaged in trying to be able to chase down fraud by the billions of dollars in unemployment systems, because the states didn't actually allocate the dollars towards actually modernizing their system. Additional dollars were allocated to the states to be able to improve their system, but we don't know if that's really being done at this point, other than states putting pressure on individuals to say that can't happen again. Mr. Turner, is that correct?
That's correct, Senator.
Yeah, that's an area that we're going to have to be able to work on long term, and how we handle the oversight on it. Thank you, all of you. Shorewich, you got off clean with me, so I apologize for that. We'll visit another day.
Although I would like make one clarification. Earlier, we talked about improper payments, and as far as being $160 billion, and I think it was confusion as whether that was improper payment or fraud. That is, 160 was improper payment, and there was a smaller subset that they haven't figured out yet what the fraud rate is.
Yeah, it's still undetermined on how high the fraud rate. We know it's in the billions, but it's still undetermined what that number is.
Well, thank you, Senator Lankford, for bringing up IT modernization and the reason, the real need for having systems that are nimble and flexible and work together. And I am all for that, and we'll work with anyone on trying to improve that. And thank you all for being here today. This is really an important topic of accountability, how we spend our money, what the data is, what we learn from it, what we do with it for the next time we need to react to, whether, God forbid, it's not a pandemic, but react to whatever situation that we have to do. We have an oversight responsibility. And we know when COVID-19 shut down our economy almost exactly 2 years ago, Congress did act quickly to provide support for American workers and families in the form of enhanced unemployment assistance, direct tax credits, support for small businesses, and other programs. And of course, we made sure that these laws had unprecedented requirements around transparency, oversight, and auditing that make this hearing possible today. I think we probably need to extend those time frames if they're about to expire. But I want to talk a little bit about the SBA, because over the past 2 years, federal relief programs such as the Paycheck Protection Program, EIDL program, have helped so many businesses, so many small businesses in Nevada, across the nation, keep their doors open, keep their workers on the payroll. In my state of Nevada, approximately 79,000 small businesses participated in the PPP program. And for you to know that 99% of businesses in Nevada, 99% are small businesses. So it is particularly important to us. But the PPP program helped us keep the doors open, help people pay their employees, and I really want to thank Nevada's SBA office, their employees, all our financial institutions. Everybody worked hard to be sure their friends, their community members had all the proper tools to see it through, and we're not quite through yet. So, Mr. Dodaro, every program, every agency is different. So we're legislating in a crisis. Of course, we just had to go out and do what we needed to do. We set up a number of new programs. And how should agencies like the SBA, which never before has stood up such a large program in such a short amount of time, how can we help them better develop strategies to prevent fraud? And can GAO provide a general framework or assistance? Because I hope this is the last time we have to do something so quickly, but it may not be. And so the lessons learned, how can we help the SBA help our small businesses?
Yes, Senator Rosen. First, we have developed a framework for helping agencies prevent fraud and how they could follow that process. Congress legislated GAO's framework be implemented in 2016. Unfortunately, a lot of agencies, including SBA, did not implement that legislation as intended. They're supposed to designate an entity to focus full-time on anti-fraud activities, do fraud risk assessments. SBA, just in February 2022, designated their anti-fraud agency. After I recommended it again during the pandemic. They've done their first risk assessments, but it's all done after all the money's been spent.
Right.
So there were expectations that these things be addressed before the pandemic occurred, but the agencies didn't move. And there needs to be more assertive encouragement, both from OMB and the Congress, to focus on this going forward. SBA also resisted overtures that I made early on in the pandemic to help them. You know, during the global financial crisis, we worked with the Treasury Department to put in internal controls right in the beginning of the Troubled Asset Relief Program. They were able to get a clean audit opinion. We got most of the money back from the banks. SBA didn't heed any of our recommendations. We even had difficulty getting information out of SBA on who was getting the loans initially. I had to go to the Congress and try to get support from the Congress to get basic information out of them. I've talked to every administrator that's been there. It's better now than it had been, but in the beginning, they needed to accept some help, and they needed help, but they rebuffed it. So I think the lesson to me out of this thing is that it's better if Congress, in legislating future emergency spending, make it very clear about how the agency is to accept recommendations from the oversight community and get some help, because we all have collectively lots of experience. We could have helped them avoid a lot of these pitfalls. and they need to aggressively implement and deal with these fundamental management weaknesses ahead of time.
Well, I think you're exactly right. No time to waste. When there's a crisis, we need to have an all-hands-on-deck approach in order to do the right thing, particularly by taxpayer dollars. And I know that all of my colleagues ahead of me talked a lot about unemployment. And so I'm not going to belabor the point about that, but we know there was some fraud in unemployment. Of course, there's always people who try to game the system, whatever the system is. But Mr. Turner, could you talk about how fraud may have threatened not just the taxpayer dollars, but how it could have slowed down legitimate applications? Because I know in Nevada we had people who legitimately waiting for their unemployment, and the system, of course, was flooded with so many others. So how does fraud impact people who really deserve to get it? Like in my state of Nevada, and of course, these outdated systems, maybe what role that had to play in it?
Well, what it did, it delays those claims is actually what happens. I think the department shoots for trying to get claims out at 87% by 14 to 21 days. And so that did not occur in the first couple of months due to fraudulent attempts. So that was part of the challenge. And it slowed the actual people that needed those benefits from actually getting them. And so we did some work on that, and we found out, and we actually put out an alert on that to the department because we were concerned about, obviously the goal is to get those out very swiftly. And when that doesn't happen, then you have people that are actually losing homes and other things like that. So the department also identified a few months later that out of 53 entities, only 5 had met that requirement of getting it out in 14 to 21 days. So that is a challenge the department understood, and we did make them aware of through our audit reports.
Well, thank you. Like I said, as a former computer programmer, systems analyst, I want to have nimble systems that collects the data and supplies the data to all of us to do the appropriate audits, because data tells a story if you know how to analyze it correctly. This is a case, again, for IT modernization, for us to be nimble, to help us all do our jobs better. So I thank you all for being here today. It's a really important discussion. I thank you for your work and your insight. And ensuring the effective use of the nearly $7 trillion in COVID-19 funds, it was no easy task. But we look forward to working with each of the witnesses here today on critical steps to ensuring that taxpayer dollars are spent efficiently and effectively, because they deliver critical services to the American people. The testimony we've heard today will help inform our legislative efforts, and I appreciate it. The record for this hearing will remain open for 15 days until 5 p.m. on April 1st, 2022 for the submission of statements and questions for the record. This hearing is now adjourned. Thank you.